Second white coat. Subscribe and like. Let's learn medicine together.
All right, let's dive into a real medical mystery. We're talking about two kinds of brain bleeds. One that's a slow, sneaky problem that builds up over weeks, and another that hits you like a ton of bricks. We're going to figure out how and why. Let's get right into it. So here's the big question, right? How can a little fall, something you might just brush off, and a sudden, catastrophic rupture both cause a super dangerous brain bleed, but in totally different ways? I mean, they seem like they're from different planets. But don't worry, we are going to crack this case wide open. Okay, so let's set the scene. First up, we have patient A. Picture this, an older guy. Takes a small tumble a few weeks back. Didn't seem like a big deal at all. But ever since then, things have been off. He's getting more confused and he's got this headache that just won't quit. See what I mean? It's slow, it's sneaky, it's just gradually getting worse. And then you've got patient B. And this is the complete polar opposite. Someone's just living their life, walking down the street, and then, bam, they just collapse. The only thing they manage to say right before it all goes dark is that they have the worst headache of their life. Just out of nowhere, an explosion of pain. Okay, so you've got these two totally different situations. How in the world do you make sense of them? And, this isn't just an academic exercise. In an ER, telling these two apart is everything. It changes how fast you move, what you do next, and the way we do it is with this awesome mental tool. A simple 3-question diagnostic key. It's basically our secret weapon for cracking the case. And here it is. Super simple. Just 3 questions. 1. What kind of pipe burst? Was it an artery or a vein? 2. Where's the leak? I mean, exactly where is the blood pooling in the brain? And 3. How fast is it all happening? You answer these 3 things and suddenly the whole picture just snaps into focus. The diagnosis becomes crystal clear. All right, let's put our key to the test. We'll start with case number 1, our older gentleman, patient A, with that slow, creeping confusion. Let's use our 3 questions and figure out what is actually going on in there. Okay, so the official diagnosis here is a subdural hematoma, and the name actually tells you a lot if you break it down. Sub just means under, and dural is talking about the dura mater, which is one of the tough layers protecting the brain. But the big takeaway here is this. It's a slow bleed from a vein. And that slow leak is what's gradually, day by day, putting pressure on the brain. So, question number 1, what's the vessel? For a subdural hematoma, we're talking about something called the bridging cortical veins. Just think of them as these little tiny veins that connect the brain surface to that outer layer. And here's the crucial part. Veins are a low-pressure system. It's not like a fire hose. It's more like a leaky garden hose. It just oozes. And that low pressure is the whole reason the symptoms can take forever, days, sometimes weeks, to even show up. That leads us right into question 2. Where is this happening? The blood is collecting in the space between 2 of those protective layers, the dura and the arachnoid mater. You can see it right here. It's just under that tough dura layer. And because there's room to spread out in there, that slow ooze of blood just kind of fans out, covering a big part of the brain's surface. And check this out. This is the big reveal on a CT scan. All that slow spreading blood creates this really classic crescent shape. It perfectly follows the curve of the brain. So when a radiologist sees that shape, ding, 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 they know exactly what they're dealing with. It's a subdural hematoma. And just like that, case 1 is solved. Okay, on to the next one. Let's tackle our second mystery. Patient B, the person who just collapsed with that absolutely awful headache. We're going to use the exact same 3-question key. Let's see what it tells us. This time, the diagnosis is a subarachnoid hemorrhage. Again, let's look at the name. Sub is under, and arachnoid is another one of those layers. But here is the massive, game-changing difference. We're not talking about a vein anymore. This is an artery that has ruptured, and that means a sudden, crazy spike in pressure inside the head. So, question 1. The vessel? It's an artery. And if a vein is a leaky garden hose, an artery is a fire hose that just exploded. It's not a slow ooze, it is a high-pressure, all-at-once disaster. And that is why the symptoms are so fast and so severe.
Question 2. The location. This bleed happens in a different spot. It's in the subarachnoid space, which is a bit deeper between the arachnoid and pia mater layers. Now, why does this matter so much? Because that's where your cerebrospinal fluid, the CSF, lives. That's the fluid that cushions your brain. So when an artery bursts here, blood just floods into that fluid and gets whisked away everywhere, all around the brain and even down the spinal cord. It's a total mess.
And that explosive mixing of blood and fluid, that is what causes the textbook symptom, the thunderclap headache. It's not a slow build, it's 0 to 100 in an instant. That sudden, insane spike in pressure is felt immediately as the worst pain you could possibly imagine. It's really the calling card for this condition.
So what does this look like on a CT scan? Well, it's nothing like that neat crescent we saw before. This is chaos. The high-pressure blood basically power washes its way into every little nook and cranny on the brain's surface. It ends up outlining all the brain's little folds and structures. It's a picture that perfectly matches the violent event that caused it.
So it all comes down to this, doesn't it? Vein versus artery. That's the whole ball game. Let's put these two head-to-head, side-by-side, and really lock in what we've learned.
Okay, let's break it down. On one side, you have the subdural bleed, our slow sneak. That's low-pressure veins, symptoms that creep up on you, and that signature crescent shape on the scan. On the other side, the subarachnoid, our sudden attack. That's high-pressure arteries, that insane thunderclap headache, and blood filling up all the fluid spaces at the base of the brain. Suddenly, our two patient stories make perfect logical sense, right?
Look, if you only remember one thing from all of this, let it be this simple phrase. This is the key that unlocks everything. Ready? Vein is subdural, and it's slow and sneaky. Artery is subarachnoid, and it's sudden and severe. Got it? That's the whole story in one sentence. And there you have it. Two patients, two totally different brain bleeds, and two completely different stories, all explained by one simple, powerful framework. We figured out the what and the why. But you know, that leaves a pretty big question hanging in the air. How do surgeons actually go in there and fix something like this? Well, that's a fascinating story for another day.